name is Sheila Greenway. I had a hip replacement on the 15th of April in 2014. Well, because I'd had 2 knees done here previously, I had no qualms about coming at all. And I even asked if I could have the same doctor because he was very nice.
And did you go to the joint school?
Yes, I did, and that was quite informative. There wasn't many of us there, but I thought it was very good. I did ask how long I'd be in, and I was told 4 or 5 days, which just worked out right because of it coming on to Easter, and they let me out on the Good Friday, and with the provision that I came back on the Sunday to have my stitches removed. So that was great. Oh yes, I got a packet of some preload drinks and some cleaning fluid sort of thing to make sure that the wound was, where the wound was going to be, was all clean, and the drinks were for to build you up because you wouldn't be able to drink or eat for a few hours. Well, they're all timed, and as long as you take them within half an hour or so of what they said, and they weren't nasty, they were just a drink full of vitamins and stuff that you would normally have with food.
Did the OT arrange for any equipment for you?
Yes, he did.
OT?
Yes, he arranged for me for a higher toilet seat, upstairs and downstairs, and one for in the bathroom for helping me to sit while I was having a wash till I could get in and out of the bath, because I was advised not to get in and out of the bath for a few weeks, with it being a step over bath, not a walk-in shower. Oh, and then he also gave me a thing to help me put my shoe on, so I didn't have to keep bending my legs so much. Well, nurses came and did temperature and the normal things, and I was asked if I could walk down to the theatre. Anyway, I went in a wheelchair eventually. I remember talking a lot in the ante-room, and there seemed to be loads and loads of lights all of a sudden, and I remember talking about my work. I don't know who was listening, but I remember talking about it. Whether anybody was, I don't know. But I must have been there maybe about an hour, and then they took me back to the ward, and I had this here big foam pad that I hadn't got to move. But other than lying on my back, which I don't really find comfortable, there was no bother at all. They told me not to cross legs and stretch, and not even to bend over to bend down and pick things up to get somebody to do it for you at first, because they said it was a worse operation to put it back if it came out after the op. Okay. I really can't remember when I started eating again. I don't know whether it was that night or I would have had drinks. I'm known for drinking water quite a bit, but I really can't think about eating at first. It didn't seem to affect me much at all, really, the spinal injection. It was, I don't know whether it was automatic thinking about it, but I don't remember being conscious of it. Right. But I think because of this thing strapped on to stop me moving, I think that maybe thought, oh well, she can't move, so don't. When they mentioned the injections and what they were for, and there's one in your stomach every day while I was in, and then when I came home I had a course of tablets to finish to stop the swelling. There was just sort of a big wad of padding on my hip, and like big, what you see in a horror picture, big bolts. And I was so annoyed because I couldn't see it, but I could feel these here metal clips. Anyway, when I got out, I got my son to take a photograph to show me. It looks a bit monstrous, but it certainly did the trick, and there's certainly plenty of padding, so I didn't catch it on anything.
Can you say when you first started walking, were you walking the day after your op?
I was walking. I think it was a confidence thing, but I made myself walk to the bathroom, which wasn't very far, of course, but yes, and of course now I'm nearly off crutches altogether, and well, around the house I can do without. They controlled the pain very well at first. Well, all the time, excuse me, while I was in, because I don't remember being in that much pain I had to ask for anything. They were attentive. They came round and do I want and certain, you know, can I have so and so, and they were very, very good. Yes, there was always a drink there, which was great for me. Well, on the day I was going home, I was pleased, but not because of the service. The service was fantastic. It really was. I just, after 4 days in there, I just wanted to be home. And then with it being Easter holidays, I think, oh no, they're going to keep me till Monday, or they're going to... Anyway, they let me go with the proviso that I came back on the Sunday to have the stitches out.
Mm-hmm.
So that was good, because I was with my family at the weekend.
Okay.
That was smashing. Well, they give me cards and letters, and I underlined one that to get hold of if I needed to. And of course we've got a phone, although mobiles are out for me, but I'm no good with mobile. But yes, I had plenty of contact and information. I didn't manage the stairs too well at home. I'd been doing them with me operation I'd had the year before on my knee, and I was doing them wrong. But when I came out this time, I was taken down to the orthopaedic place and shown how to do steps properly and take the weight off this part of your body and do this, and that was a lot better, and which is what I do now. And I'm quite, you know, fearless on the stairs now. It's great. They didn't tell me, or didn't try to tell me, how long it would feel before I could drive again. That was the worst part.
Okay.
But nobody can explain time to you. But other than that, no, there was... Sometimes sitting at the table, they didn't say, well, look out for a lower chair. Not all chairs are the same height. But I didn't bang my hip or anything, so it must have been all right. I've just been steady. I was talking to a lady in the shop, and she said, don't do the exercises they tell you. She said, don't do them, which I had been doing before. They give you some to do before. She said, just walk. She said, that's the best exercise. She said, just walk. So I'm now
And you have
walking.
kept walking?
Yes, now walking.
Okay.